I think we are possibly going to see the start of the first tax revolt in our new democracy, where society says enough is enough.
The Fields Hill horror smash highlighted the deficiencies of the road, freight and transport industries. Just how difficult is it to roadworthy a wreck and buy a heavy-duty truck license? The Carte Blanche team goes undercover to expose a system riddled with corruption.
Flippy Engelbrecht, a brutal assault on a farm worker's child or a distorted tale of deceit and political opportunism. Carte Blanche investigates.
Die hele storie gaan oor geld, want die hele storie is leuns.
From Eastern Cape public servants lining their pockets to corruption contributing to road carnage and a South African paddler attempting the impossible. Welcome to tonight's extended broadcast. Good evening, one in which you have 90 minutes of Carte Blanche coming to you live from our Randburg studio. An investigation into the collapsing health system in the Eastern Cape paints a devastating picture of mismanagement and political indifference. 2 billion missing, 800 million rand of it in just 18 months. Here's Devi with a story that's sure to evoke outrage.
The Eastern Cape Health Department is bleeding money, 2 billion rand unaccounted for. A forensic investigation has revealed that 1.4 billion rands has been lost to fraud and corruption, 800 million of it siphoned off by provincial health officials and their cronies. Former Minister in the Mandela Cabinet, Jay Naidu, reacted with outrage to a Section 27 report last month, which laid bare the disastrous effects of this wholesale pillaging.
I think about what that 800 million rand could have bought. How many vaccines, how many needles, how many x-ray machines we could have bought, how many nurses and doctors we could have employed. And yet our people are dying. Babies are dying.
The SIU report revealed that more than 10,000 employees were taking social grants for which they didn't qualify, and that there were nearly 600 ghost employees. Siva Pillay, the former Superintendent General who was responsible for much of the corruption busting and forced over 1,000 corrupt officials out, believes the Premier, Nkolo Kivet, who took over the investigation, needs to crack the whip.
All that was done was these people were asked to sign stop orders to refund the money. There was no disciplinary action taken against any of them.
The balance of the alleged corruption comes from departmental staff irregularly doing business with the department.
We found more than 12,800 people doing business with the department, but they could do nothing.
We wanted to know what MEC Sicelo Kobana was doing to root out corruption, so we went in search of answers in Bishu. But the MEC dodged our interview requests. After some persuasion, the newly appointed Superintendent General, Dr. Tobile Mbengashe, who replaced Siva Pillay, agreed.
Most of these frauds were happening in the supply chain. So you will find that a person who is employed in the Department of Health, who works within the area that will have a number of his friends or families that actually do business with the government itself. And then within that system, they will either first make sure that all the business goes to those people, overcharge the department, duplicate invoices, and make actually false claims.
Do you know how morally corrupt you have to be to choose to work within the Department of Health and then still do that to people?
But obviously, there are bad people who makes everyone look bad.
Lots of bad people.
Lots of bad people who makes everyone to look bad.
Section 27 activist Mark Hayward, who last month published a report, Death and Dying in the Eastern Cape, says this massive fraud has created a dysfunctional and inhumane health system.
It is a ticking time bomb. The problem is time bombs explode, and all it's done in some ways is imploded on the people who are in the middle of the bomb zone.
Lindeka Kala, who is featured in the Section 27 report, is one of those people. She lives and works in Mthatha Mouth in the Oliver Tambo district. It's the poorest area in the whole country. More than anything, Lindeka, who was orphaned as a toddler, wants a child of her own. And she was thrilled in February when she fell pregnant.
I was so happy because I've got no family.
Not wanting to take chances, she did the 10-kilometer trudge to the local clinic every month. But they're chronically understaffed and she was turned away. So she arranged to go to the Nelson Mandela Academic Hospital in Mthatha for a scan.
They asked me if I feel any pain. Then they said that can't find, the heart is not beating, the heart of the child.
Without access to regular checkups, no one picked up there was a problem.
She was given pills that are bought, but not properly counselled about how those pills are meant to work.
She was admitted to the maternity ward and had to share a bed with a woman already in labour who was bleeding onto the floor. At midnight, Lindeka started experiencing intense pain.
In the middle of the night, she started to abort the 6-month-old fetus.
I went back to the nurses and told them that there's something here. Then they said there's no bed here. You must wait.
So she pleaded with the nurses for help.
Then the other young nurse asked me to pull up my skirt. Then she saw the baby between my legs.
The baby got stuck, the head got stuck inside. She had to wander around the hospital literally with the baby's legs hanging out of her for several hours and wasn't actually taken to have the baby removed until the next morning.
After her harrowing ordeal, Lindeka was sent home the same day.
They don't care. They don't care.
And this in a province that prides itself as being the home of legends.
Here we are, having committed in 1994 to deliver a better life to our people. One of the most fundamental outcomes of that was quality health and education. These are the two biggest crises in our country. This is not what Steve Biko or Neil Agate or Nelson Mandela fought for.
Lindeka is still deciding whether to take action against the department. If she does, she won't be the only one. In the last 5 years, more than 258 million has been paid out in legal fees and medical negligence claims in the province.
In just the month that I've been here now, the weeks that I've been here, I can tell you probably over 20 million rands have already been signed as negligence.
DA Shadow MEC John Cupido says the figure is growing annually.
In some cases, they could correlate facts and figures against those doctors. So that means that over the last 5 years, the doctors, nurses and officials that have been found negligent and that have caused harm to patients and have caused people to die because of negligence are still in their positions, which clearly tells you the department has no interest in the patients on the ground.
But it's not just negligence and understaffing that is creating a problem. The backlog on operations, especially orthopedics, is huge. Gavin Rustenberg, the 36-year-old father from East London, has been crippled by early onset osteoarthritis and needs a double hip replacement at Freya Hospital. The former avid sportsman can barely do anything for himself these days. He needs help getting in and out of cars, bathing, and even getting dressed.
If I get 3 times a week sleep, it's a lot. And I get up quite often at night because I get so much pain and that.
All the hospital offers him is a mild painkiller.
They gave me Panado.
That's it.
That's it. They said, go home, take the Panado.
He could still stomach getting handed Panados if he knew how long it would take to get the operation done, but no one can tell him.
Say they can't, and they're batting to find the list. And the specialist says, no, I can't go on the list yet. I must rather wait.
They lost the list.
They said they lost the list.
Gavin could find himself waiting 5 years.
Why 3 to 5 years?
There aren't enough doctors and nurses and that the budget needs to be increased.
So we called newly appointed CEO of Freya Hospital, Rolene Wagner.
Do you perform hip replacements at Freya Hospital?
Yes, we haven't been doing it for about just over 2 years.
She also said that there were over 100 people on the waiting list and that the elusive list had reappeared.
How does a list like that go missing?
I don't think it was as much as gone missing as that they did not maintain it because they were not providing the service.
And Panados for severe pain.
Panados will not be adequate.
No, it won't even say hello.
Gavin and his fiancée Susanna now resorting to other provinces for help.
They won't take Gavin. Why?
Because we're not from that province. You have to get help from the province that you live in.
But here in your own province, they can't help you either.
That seems not to be their problem. That's my problem.
But if the coffers weren't cleaned out of millions of rands, Lindeka and Gavin's experiences might have been very different.
We cannot allow a predatory elite today to assassinate the hopes and the freedoms that are enshrined in our Constitution.
The Superintendent General assured us action is on the cards.
How many people have been fired?
10 or so people who were really central to this kind of fraud. There are other investigations that are ongoing, and some of them are actually, most of them are with the police.
Phumla Vazi, the chief financial officer, was fired and charged with 12 counts of gross misconduct for giving 7 million rands in tenders to her family, but she hasn't paid back a cent.
We've tracked the sacked CFO Phumla Vazi to a house in the rather upmarket suburb of Bunkers Hill, East London. Let's see if she's home.
We rang the bell and the gate opened.
Ah. It's never happened before.
And we walked up to her 4 million rand home.
I'm looking for Phumla. Not here.
So we went back outside and waited for her. Her garbage on the verge told a story of designer tastes. Just then we noticed someone spying on us from the master bedroom. So we called Phumla and her daughter answered.
And is she going to pay the money back?
Pay the money back for what?
Well, for the money she misappropriated.
How much money did she misappropriate?
What was she
What money did she take?
Well, why was she dismissed then? Why was she dismissed?
Because she didn't take any money.
Phumla never returned our call. We asked the department if they plan to recover the plundered millions from officials.
Yes, we have actually been able to retrieve some of the money, and it's quite an extraordinary amount of money. I mean, it's over 107 million.
But worryingly, we found that some employees listed in a leaked page of the report were still at their posts in hospitals and the department.
Public servants should be fired if they steal the money that is supposed to be building clinics. We want action, but that action has to come from citizens who are organized, aware of their rights, and prepared to hold their leaders to account.
We have not just reported people to the police and the Hawks. We have regular meetings with them to try and find out exactly where the process is. We have regular meetings and to find out exactly what else do they require in terms of information that we have, so that we can facilitate the process, but it does take time.
Siva blames the situation on party politics.
It becomes very difficult to take action because everybody is in some way known to somebody else and they're interrelated. We don't choose people on competence anymore. It's patronage.
Patronage has done nothing for Gavin or Lindeka. In fact, it's robbed Lindeka of the desire to ever experience motherhood.
I'll be scared to go there. I'm still not right even now.
Her story has moved Health Minister Aaron Matsuledi.
Stories like that will definitely touch me as the Minister of Health and as a doctor. And I'm promising you here that I won't be scared to take action.
The question is, can the situation be fixed?
We wouldn't be having this fight if we didn't think that it could be fixed. It can be fixed because many of the causes of the problems are understood. So once you've got the diagnosis, you need to apply the remedy to the diagnosis.
Our patients should be really our priorities, and we need to be really responding to the patients. These things will take time to turn around, but I do think that, you know, with reports like yours, highlighting some of these weaknesses into our systems makes us to be aware and actually take attention.
Jay warns if that turnaround doesn't happen, there will be dire consequences.
That moral moment of indignation, of public indignation has arrived. We've had enough, and it's time to draw the line in the sand.
Indeed. Some good news is that the Carte Blanche Making a Difference Trust is busy with an ambitious project to upgrade parts of Freya Hospital in East London. Our project will include 2 paediatric operating theatres, and we hope to raise in excess of 15 million rand to assist children in the Eastern Cape.